All right, hello everyone. I'm Blanca Stupignan. I'm finishing my dermatology residency at Loyola University Medical Center in Chicago. Today we'll be sharing our study on a 785 nanometer titanium sapphire picosecond laser for the treatment of brown nevus of Oda lesions. I have no conflicts of interest to disclose. To briefly review, nevus of Oda is a dermal melanocytosis acquired in childhood or during pregnancy and presents with unilateral pigmented macules and patches in the V1 and V2 distribution. It is most common in Asian and Black populations, therefore treatment should be safe for skin of color. More recently, studies have shown that picosecond lasers may be favored over Q-switch models due to the ultra-short pulse duration effectively targeting small melanin particles with a lower risk of dyspigmentation and overall fewer treatments. Currently, there is one published case by Drs. Lo and Wu describing a novel 785 nanometer picosecond laser successfully treating a refractory nevus of Oda lesion in one patient. Previous studies with histologic analysis of nevus of Oda have found that brown lesions have more superficially infiltrating melanocytes, with pigment most concentrated in this plane, whereas blue lesions have an overall higher density of melanin, which is located deeper in the dermis. Given the variability of lesion color, a combination of wavelengths is often required for successful treatment. To further explore the efficacy of the 785 nanometer picosecond laser, we conducted a retrospective review of patients. We identified 36 patients with brown nevus of Oda lesions, and after applying the exclusion criteria listed, we reviewed 17 patient cases. 3 board-certified dermatologists graded clinical improvement using a 5-point scale. Our patient sample ranged from 14 to 38 years old, and Fitzpatrick skin types 2 through 5 were represented. 94% were skin of color, with the majority being Fitzpatrick skin type 4. Patients underwent an average of 3.2 sessions at 1 to 2 month intervals, and the parameters listed were utilized. Follow-up visits range from 1.5 to 9 months after the final treatment. Overall mean improvement of our sample was 51 to 75%, corresponding to good improvement on our grading scale. Further subgroup analysis revealed that 4 to 7 treatments may be required to achieve good to excellent results. Of note, all patients responded after 1 treatment, and there were no adverse events such as dyspigmentation. Here's one patient who underwent 6 treatments and achieved a significant clinical improvement. Here's another patient who completed 7 treatments with an excellent clinical improvement. And here's one final patient who achieved excellent improvement of her lesion after 5 treatment sessions. The current study is the largest to date, demonstrating the efficacy and safety of a novel 785 nanometer titanium sapphire picosecond laser for the treatment of nevus of Oda. We noted good to excellent clinical response within 4 to 7 sessions, with all patients responding after 1 treatment. Of note, older age, higher Fitzpatrick skin type, and periorbital lesions may be more refractory, requiring more treatments. Despite these factors, our study demonstrated significant clinical improvement. With our patient population being predominantly skin of color, it appears the 785 nanometer picosecond laser is safe in this population. This could be due to the shorter pulse duration and slightly deeper depth of penetration compared to the 755 wavelength, and higher specificity for melanin compared to the 1064 models. Additionally, the very short pulse duration limits heat dissipation into the surrounding tissue. Larger studies are needed and should consider the inclusion of blue-gray lesions and pediatric and Fitzpatrick skin type 5 and greater populations. These are my references. And thank you to ASLMS for this opportunity, and a special thank you to Drs. Friedman, Swally, Guo, and Richmond for including me on this project. Thank you.